Hey everybody, Dr. Colleen Sierra here. I'm a licensed clinical psychologist and the founder and executive director of Sierra Center for Behavioral Health. Welcome back. Wanted to continue what we were talking about last week. Last week we were talking about, the end is in sight. And when we're in the middle of something very difficult or traumatic, we often don't fully feel the effect of it. And it's not until the end is in sight that we start to feel it, right? So a lot of us are feeling it right now because we can see the end. And there could be a lot of things going on with that. One of the things that I'm hearing a lot, though, and experiencing a little myself, is burnout. The amount of burnout right now is really profound. Certainly in my field, but I think with a lot of people, it's just too much. It's been too much to manage. And that's true across the board, but I think that's especially true if you're a parent and especially if you're a mother. So this post is for the mamas. This post is for the burnt out mamas. And I am right there with you. So that's certainly been one of the effects of this past year. And while you likely don't need the definition, you feel it, you understand. I'm going to give it to you anyway. So according to the American Psychological Association's dictionary, burnout is the physical, emotional, or mental exhaustion accompanied by a decrease of motivation, lowered performance, and negative attitudes toward oneself or others. Yep. And it results from performing at a high level until stress and tension, especially from extreme and prolonged physical or mental exertion, results in just an overburdening of the workload and they take their toll. Yep. That's been a reality for about a year now. That's been the reality. So if that's resonating for you, you are in very good company. That's happening for a lot of us. So again, there's a few different stages of burnout that I want to share with you. Again, you probably feel it, but I want to normalize and validate it because so many of us are feeling terrible. We're like, what's going on? Am I depressed? Am I this? Good chances are you're just in good company. So 5 stages of burnout. There's the honeymoon phase. There's like, it's a new challenge. I got this. Okay. Then stress starts to come because it's more difficult than you imagined, or it just starts to take a toll. The stress doesn't go away. So that's been especially true with this pandemic. We're living at very heightened levels of stress for a very long amount of time. So that's chronic stress. And when there's chronic stress, burnout happens. And when you stay burned out for a really long time, now we're in habitual burnout. So I'm going to go ahead and say that a bunch of us are in habitual burnout where we've been operating at a level that is not sustainable. And we're starting to see things fall through the cracks. We're dropping balls. Our memory doesn't work the way that it used to. We're not able to perform at the level that we used to in any number of roles, in terms of parenting, in terms of employment, perhaps in terms of our marital or friendship relationships. We're not performing at the level that we used to because we've been in burnout for so long. So if that's you, breathe. You're in good company. So many of us are right there with you. So what do we do? That's really the question, right? What do we do? When burnout is from a job, especially helping professions, the medical field right now, the psychology field right now, social services, people in those folks are really likely to experience burnout at some point because of compassion fatigue and having to give, and are people getting in return or getting refilled in other places. So when burnout is caused by a job, it's a lot easier. You can take a vacation or take more time off. You can figure out how to get more autonomy. You can work to figure out, how do I get more meaning out of this job, right? There are some really specific things that you can do when it's a job to help reduce feelings of burnout. But when burnout is caused by life, by a pandemic, by homeschooling, by working from home / living at work, by racial and social injustice, right? When burnout is just a result of life, that's a lot more challenging. right? So I could go on and on about some things that I have found to be helpful, but I think the main thing I want to focus on right now is support. We can't do this alone. You can't do this alone. You never should be doing it alone, but if you were before, you really can't do it alone right now. We need support. So how can you get that from your life? Where are the sources of support that are already there and you're not tapping into? Or are they lacking and you really need to seek them out? So thinking about how you can get some more support is the main thing I want to leave you with today. And CCBH is going to help with that. I was having a conversation with a lot of Oak Park working moms the other day about the level of burnout in this community in particular. And so CCBH is starting a burnt out mom support group. So if you really need somebody outside of your circle, somebody who's not your family member, not your partner, not your friend, to just commiserate with and support each other, let us know. We are creating a couple of different groups. One is likely going to be in person and outside, COVID safe. The other is likely to be virtual. So if you're curious to hear more about that, give us an email. You can reach us at admin, ADMIN, @sierracenter.org. You need some support right now, mamas. Something to think about.